Vital signs, blood pressure. Blood pressure is frequently called a BP, and it is the force of the blood against the artery walls as it is circulated. It is affected by three internal factors: the strength of contractions, the amount of blood flowing in the circulation, and the resistance or elasticity of the blood vessels. The blood pressure is actually two measurements: the top measurement, which is called systole, and the bottom measurement, which is diastole. The systolic pressure is that pressure during the contraction, and the diastolic pressure is the one during relaxation of the heart. The blood pressure is recorded as a fraction. 122/74 would be an example. The systolic pressure is always the top number. Think about sky above, and the diastolic pressure is always the bottom number, dirt below. You should never take a blood pressure on an arm that has an IV, a dialysis cast, recent trauma, paralysis from a stroke, a burn, or they have had recent breast surgery on that side, such as a mastectomy. Accuracy is very important. The results can be used for diagnosis and treatment, and inaccurate results could constitute an error in either diagnosis or treatment. Patients who exhibit anxiety over potential test results or findings can have an inaccurate blood pressure. If they're angry, or maybe they have rushed into the office, if they have had something to eat or drink before the visit, sometimes those things can affect the blood pressure and pulse and temperature. If they've had a long wait in the reception area, it's really important to assess their apprehension and their mood when you're taking vital signs. Common errors in blood pressure measurement, and we can try and avoid these by doing the proper thing. Make sure you have the right cuff size. It's not too small, it's not too big. Make sure the arm is at heart level, that you aren't holding it up above the heart, or the patient isn't holding up above the heart. It can cause an increased blood pressure. If the cuff is not completely deflated before you put it on, it can have a higher pressure measurement. Deflation of the cuff is faster than 2 to 4 millimeters per mercury per heartbeat, or 20 to 30 increments on the gauge. You can miss sounds. Reinflating the cuff during the procedure without allowing the arm to rest for 1 to 2 minutes will cause the blood pressure to be inaccurate. Patients who are not relaxed and comfortable are anxious, apprehensive. They will have a higher than actual blood pressure reading. The improper cuff placement. If it's not over the brachial artery correctly, or if it's too loose or too tight, it can alter the reading. Defective equipment in which there are air leaks in the bladder or valve. In measuring a blood pressure with the thumb on the head of the stethoscope, you may pick up your pulse rather than the actual blood pressure. All these areas are easily corrected by following careful procedure and by having the manometers calibrated and cleaned according to a regular maintenance schedule.